my name is Megan. I am going to be your nurse practitioner today, and I am going to perform a cardiac assessment. So the first thing I'm going to do is I'm going to assess for any heaves or lifts. I'm going to do that by using the fingertips, pads my fingertips, and I'm going to start by pressing them onto the right intercostal second space, moving over to the left, down to the third intercostal space, down to the fourth and fifth, and down to the apex of the heart. And I'm expecting to feel my hands come up if there were any heaves, but there were not. So then I'm going to assess for any thrills. And I'm going to do this by using the ball of my hand. And I'm going to, again, go in those same areas, and I'm feeling to see if there's any vibration. Next, I'm going to identify the apex of the heart. So the apical pulse is down here in the mitral area in the fifth intercostal space, and that is where I will be able to auscultate and hear the rhythm and rate of the heart and get the patient's heart rate if I were to listen for 1 minute. And then I'm going to auscultate some other parts of the heart. So I'm going to start here in the second intercostal space near the sternal border on the right side, and I'm listening to the aortic area using the diaphragm of my stethoscope. Then I'm moving over to the pulmonic area, which is on the left side in the second intercostal space. Moving down to the third intercostal space, I'm listening to Erb's point. Then I'm going to move down to the fourth and fifth, close to the sternal border, and I'm listening for the tricuspid area. Then on the midclavicular line on the left side, on the fifth intercostal space, I'm listening here for the mitral area. And then I'm going to listen to all of those areas again using the bell of my stethoscope. And while I'm listening, I'm trying to identify if I hear any murmurs. And another way that I can listen better for some murmurs, such as the mitral murmurs, is I'll have the patient lie in a left decumbitous position. So I'll have you lie on your left side. And then I will place my diaphragm of the bell of my stethoscope in the mitral space and listen there. Good, thank you. And then I'm going to try to listen for how long it is, the pitch and the duration. I'm trying to see if I hear any S3s or S4, but he only has S1, S2. And then I'm going to have the patient sit on the edge, and I'll have them lean forward a bit, and I'm going to listen to the aortic area to see if there's any murmurs in that place. But first I'll have them take a deep breath in, and then breathe out, and then go ahead. Good. I'll use the diaphragm of my stethoscope for that. Now I'm going to assess the carotid. So I'll have you lay back in that 30-degree angle again. I'm going to have the patient hold their breath when I auscultate, but first I'll just do some palpation. I'm feeling to see how strong the pulse is, how turbulent the blood is going through there, looking for any signs of atherosclerosis. Then I'm going to use the diaphragm of my stethoscope to listen on both sides, and I'll have the patient hold their breath while I do this so that I'm able to hear better. Then I'm going to measure the JVP. So to do that, I'm going to utilize a piece of paper and a ruler. So I'm going to put the piece of paper at the point of meniscus where I can see the pulse of the jugular vein right there at the highest point. And then I'm going to use my ruler, and I'm going to put it vertically by the jawline, and I'm going to measure the right angle that I get, which I am getting 2 centimeters, and then I will add 5 centimeters to that to get my JVP, which would be 7 centimeters. And that's it. Thank you.